Thank you, Madam Speaker. The Greens were very supportive of the strong announcements that the Premier made on the weekend, and we commended him for the decision around the ban of cruise ships to the state. We were expecting, coming to Parliament today, that we would hear more of that strong language and strong restrictions from the Premier in response to what has been so much change since just Sunday afternoon. It is good to hear some of the things that the Premier has just announced, but I am saddened in reading and listening to him about the lack of attention to the urgent issue which needs to be addressed today, and that relates to the restrictions for the safety and well-being of Tasmanians. What the Premier has discussed in here in terms of restrictions that will be used to limit the spread of the virus is he is urging Tasmanians to practice social distancing. And the sort of social distancing that he is urging people to individually take responsibility for will go a very, very small step of the way along the long road that we have to get on top of this virus and the serious impact it will have on all Tasmanians, including the overwhelming of our hospital systems with having to care for sick people and the expected deaths from the number of cases which are being predicted by senior medical officers around Australia today. So it is very concerning to hear only small steps happening at a time where we were expecting to see and hoping to see real, strident and strong responses. Tasmanians who I guess are Tasmanians' anxieties around the changing nature of this global pandemic can best be embodied by the letter, the open letter that was written last night by, I don't know where it's up to, but 140 Tasmanian GPs, Madam Speaker. And these are the people who are at the coalface already dealing with people who are anxious, already testing for people for coronavirus, and now cautioning us that they wanted to hear so much more from this Premier today. They have written to him, written to all members of Parliament, asking for the interventions which have been shown to be effective globally to slow down the spread of this disease. The only interventions that have been shown to be truly effective to slow down the spread of disease across every country so far that is in advance of us are incredibly strong social restrictions and very strong and stringent quarantining of people coming into areas, and in this case it would be into Tasmania, so that the number of cases moving into a region, infected people can be slowed down, and so that it gives the health system in each area an opportunity to deal with the cases that will arise, 5% of whom will be serious and will require high-level hospitalisation, hospital care, and at least 1% of whom will die, Madam Speaker. And what we've heard from the Deputy Chief Medical Officer at the federal government level yesterday in the Sydney Morning Herald was the very, very clear statement that he said we've been asked to give frank and fearless medical advice from the beginning. And the medical advice that he gave yesterday, Madam Speaker, was that the expectation is that a minimum of 20% of the Australian population will be infected with the COVID-19 virus, and up to 60%. If you look at those figures Australian-wide, as he told us yesterday, that is 50,000 Australians will die from the COVID-19 virus minimum, and 150,000 is also possible. Now, if we look at those figures in Tasmania, Madam Deputy Speaker, what that equates to at a minimum is 104,600 Tasmanians becoming infected with COVID-19 virus, 5,230 of them needing hospitalisation, and 1,040 people dying. Madam Speaker, that's the figures that our Australian Deputy Chief Medical Officer tells us. At the higher end, Madam Deputy Speaker, that equates to 313,800 Tasmanians becoming infected, 15,700 hospitalisations, most of whom may require intensive care, and 3,130 people dying. These are the really serious figures that we're dealing with here. So my question is, Premier, are you preparing for those figures? Because that's what we're confronting. And what this day provides us with, every hour that goes on, more people are likely to become infected, and it gives us a really important moment, an opportunity to grab this time and look and understand that we have the opportunity to restrict people coming to Tasmania who are travelling back from the mainland. They may be Tasmanians, or who may be Australians living on the mainland, as well as international visitors, because the people on the mainland, as the New South Wales Health Minister has said, they have already exponential rate of cases. We have a huge increase, 37 cases in New South Wales just today. So these are the actions that we need. And what we have, Madam Speaker, is 23 stimulus actions here, economic stimulus actions, and 6 which are directed at supporting the community. We need to have a much greater focus on vulnerable people. We have so many vulnerable communities, and when the West Australian government, when the French government can waive electricity charges, they can waive rents, and they can waive the costs that are going to really cause harm for families in the community, when they can do that, we can take the opportunity to do that, Madam Speaker. So around $10 million of this is focused on supporting vulnerable people and communities, and about $410 million of this is an economic stimulus package for businesses. That's a very important part of it. But I don't understand that there is really the correct focus on looking ahead for vulnerable people and implementing today the restrictions that we need to protect those communities, including closing schools, limiting people in public places, Madam Speaker, which is what all other countries around the world are now doing.
Yes, it is time. Thank you.
Thank you.